sheet for a second. Basically it's going to go over the high pressure systems. So that's the high pressure system is basically the oxygen tank. So we checked it in the back. All the information will come up right here. So the tank, the PSI is 1353, 1348 in between there. So you want it above 1,000. If it goes below 1,000, you have to switch. And that just gives you the pressures for the lines coming from the wall. So oxygen 55, nitrous 55, air 49. And you have to record them all on here. Okay, so circuit test is done, everything passed. Now you have to do your circuit O2 cell. So you hit that. You want to open the patient Y. So just leave it open to atmosphere, and you want it to switch to vent. Basically you're looking for the FiO2 to drop to about 21-22%. So it's going down. We have to give it a second. While that's going on, we can look at more of the checklist. The second part is the low pressure system. So check the CO2 absorbent, which we did, fill the vaporizers, and the low pressure check, which was the one we did right here with the bulb. So that's done. The scavenging system, you just have to make sure it's connected. That's that pink line in the back, which we already checked. Automatic ventilation system, so we haven't, that's the last part you do. Basically turn the vent on. There's the monitor vacuum. That's all your equipment, which Cody's going to go over in just a second. So, circuit O2 is at 21%. So you actually have to record 21% on this. Okay, so we're going to hit done. The next one is the low pressure, agent delivery. So for this one, you're going to take the SIVO out and put the desflurane in. Make sure they're both locked in. Okay, so you're going to occlude the patient circuit because it's going to actually be desflurane going through, will come out the end if it's not occluded, and you don't want to breathe it in. So put it to vent, it's already on vent right here, ACGO to circle and occlude. So start. That's going to take 2.5 minutes, and while we do that, we're going to do the extra equipment we have to check.
Okay, so that's in the drawers here. So in the top drawer, you want to make sure you got some lube. You want to make sure you have some extra blades and handles, and you want to make sure that it's working. So you can see the light there. Yeah, just make sure they're all working. And always make sure that you leave a blade on the handle when you're done. You want to make sure that you have extra 10cc syringes to inflate and deflate the cuff. You want to make sure you have extra wands and stuff for the lidocaine spray, and make sure that there's some in there, and make sure that it's not expired. You want to make sure you have extra, or that you have McGill forceps in case you need them. Extra swivels for the end of the tube, and you want to make sure that you have MDI adapters to give MDIs. In the second drawer, you want to make sure that you have a good variety of masks ready in case you need them. Make sure they're all in nice order, and make sure that you have lots of OPAs in case you need to use them when you're bag masking or anything like that. And in the third drawer, you want to make sure that you have lots of anesthetic gas, and if there's any missing, you just go get some and refill it, and make sure that you have all the tubes that you need, and you'll also have your bulb in the bottom here for your low pressure test.
Okay, so the agent delivery is done. So you hit back. Before you actually start the ventilator, you want to go to the check log and make sure that everything's passed. So pass 16th, 16th, 16, 16, 16. Everything passed today. So yeah. So to start the case, you go all the way down to the bottom. Start case. You always want it set on bag before you switch it over, because you're always going to bag a patient prior to intubation. And so I'll show you. I'm going to set it to vent and just show you what happens. So I'm going to try to start the case. Oh. Start case now. So it's going to give you an error, move or switch to bag. Yeah, so you switch that over and it'll automatically start. So you can bag the patient. Nope. Yeah, and I made a mistake. So you have to take the patient, well, unocclude it and hook it up to a test lung. So, yeah, that's fine. So we're going to switch it over to vent. So the mode it always starts out in is pressure control ventilation with volume guaranteed. So it's kind of like PRVC. You have a set tidal volume, and it's only giving about 300 mils right now, 216. So it's going to increase the pressure until it hits that. You want it to be within 7% of the 600, whatever you have set. So you have to test 4 alarms in the vent mode. The biggest one is in the back, the oxygen failure alarm, which is right up here. You have to disconnect that. Okay, so we're going to go around to the front. It's going to give you an audible and visual alarm. It won't let you do anything until you either hook up the cylinder or fix the problem. So I'm just going to hook it back up. Okay, so that should go away. So yeah, you always have to make sure that's working. So it's almost there, it's at 500 now. Down here is the O2 flush button. It gives, when you hit that button, it'll give about 35 to 70, 75 liters per minute straight to the patient. Just gonna wait for this to go. So it's at 544 right now. It's a couple more breaths and it should get there. You have to record the actual tidal volume, the closest you can get. So, yeah, I'm going to show you the 3, so it's a 588, it's within 7%. So, basically you have to do a high pressure, a low pressure, and an apnea test. So the high pressure, you're going to take the bag, and when they take a breath in, you're going to squeeze it. So create a really high pressure. So, high pressure. And to get the low pressure, basically you just disconnect the bag, and after a few breaths, the bellows will completely empty. You should be able to see it up here in a second. So unable to drive bellows. So that's the low pressure test. There's a big leak. We're going to switch it over to bag to test the apnea alarm. So this takes about 30 seconds, but hopefully it will come up. Let's see. Oops. Should be coming up in a second. Okay, apnea. I'm just going to show you when you hit the O2 flush button, you can see the bag starting to fill up, so it's going straight to the patient. That's all you have to do for this part. So you hit the little start end case on the side, and end case now. Okay, so before you finish everything, you want to get rid of any alarms, like past alarms that are up here. So you just hit the silence alarm buttons, just because it confuses some of the people that come in every once in a while. So basically the last part of the check is the final position. So you want to hook the bag back up to circuit. You want to hook your breathing circuit, so you have your mask, HME, and you have your end tidal hooked up. Sometimes they get you to test the end tidal. You basically just take a mask and you put it inside of it and you breathe into it a few times, and you'll be able to see the CO2 pop up. They also want you to test the pulse ox, so you just put it on yourself. That part's really easy. So the circuit's all ready. You want to make sure that it's set to circle, so it's pointed up, which it is. You want the APL valve to be set to minimum, which it is, and you want it to be set to bag. And you want to, the only other thing we didn't do is test the suction. So the suction stuff is right here. And you can put it on max. You can hear it, but it's always a good idea to put on some gloves. And yeah, so the suction's adequate. You can put it on there and adjust whatever suction you want, but most of the time it's just going to be Yonker. And That's pretty much it. If the case doesn't start in an hour, you can turn off the monitors. If not, you can just leave it in standby, just like this. That's pretty much it for the